So yes, you need to discuss the hormonal parameters. If at all there are any fluctuations, paradoxical hair growth stimulation is a concept. Make your patient aware. Tell them not to shave very often in between the sessions. You allow them to shave maximum once or twice between the sessions, and clearly tell them to not shave the area at least a week before they're coming for the session, so you can mark the area well and make sure that the right laser is being done, like the right readings are being used. So written consent before and after pictures. Sometimes we take it very lightly that, okay, this is just a laser hair reduction patient. I don't even need to see it. My technician is doing it. But if at all it's a face laser that you're dealing with, if it is a patient who's already unhappy with a lot of other doctors is coming to you, it's actually not the doctors, it's the technique probably that's not working for them. So make sure that you take the before and after pictures and speak to them as they come along with every session. They need a little bit of hand holding, and there should be session documentation every time that they come to you to understand as to what energies are being used. Now, we need to ensure every one time that the laser is being performed in your clinic that there's eye protection being used for the patient, for the operator. You have always to mark the area that is not being lasered. A lot of times you're doing the lower arms and the patient will be like, doc, my upper arms were not done. Make sure you mark it for them. You tell it to them that this is not a laserable area that I'm going to be working on to now, and we're not working on this area. The area that is being treated is to be made grids off, because all these devices, they are, pretty smart. They are calculative. Every one grid has a given energy. So for good efficacious results, we need to make sure that a certain amount of energy is delivered in that particular grid. So you need to make sure that the grid is well marked. Now, every time a patient comes to you, please make sure a fresh razor is being used. Show it to the patient. It seems very simple, but it's very, very important. Show them that a fresh razor is being used. The way that they're going to be shaving you, that's very, very important. Shave in the direction of the hair. If at all, double shave. Always use a magnifying glass to make sure that there's no residual hair even on the surface of the skin. Right? And you have to moisturize the area before and after the treatment. The skin has to be intact. The barrier has to be intact while you're giving so much heat to the area. And if at all you're doing the bikini area, please understand the importance of inserting a wet gauze. It not only increases the surface area where you're working on, but also makes the patient more comfortable. Now, a patch test should always be given before you're starting the laser. This is not to basically give the patient an idea about how the laser is going to work for them or what the results are going to be like. It's more about the feel of the laser as to how is it going to feel like when they're working on a larger surface area. Now, in the end, we're all working in the aesthetic industry. We know it's all about the experience. You have to make the patient feel calm and welcome. You have to make sure that the temperature is ambient, because the patient is going to be dressing down. You're always going to be covering the area that is not being treated at any given point in time. And you have to make sure that it is a clean and neat environment that the laser is being performed in. So triocluster laser makes sure that you're targeting different follicles at the same time, increases the treatment efficiency. What I like about my laser is basically it gives me a hygiene tip that I can use for every one patient, especially in the COVID time when the patients were really finicky about these things. You can actually use an individual hygiene tip which can be attached to the laser. It comes at an extra cost, which isn't a lot. You give it to the patient, they come back to you with the tip. They can actually keep it in a Ziploc and carry it with them when they're coming for the next session. So now very small areas can be used, treated with a small facial tip, like the lobes and the midbrow, the eyebrows. Not a big fan of eyebrow shaping myself. I would say do not do a lot of eyebrow shaping because the trends are ever so evolving. Right now, thin brows might be in. A couple of years ago, later it could be thick brows, and then the patients feel trapped that they've already done the hair reduction. So do not do like a lot of brow shaping. You can definitely do the midbrow, you can do the beard shaping, you can work on the finger and the toes also. Now, the operating screen is very simple. It's a touch screen. While we're going to be doing the demo, we'll show it to you. It's all pretty self-explanatory. Now, the SHR mod treatment protocol is very, very simple. We tell the patients that you may need 6 to 10 sessions. Session gap is about 4 to 6 weeks, depending upon the area that we are going to be treating. What you do is you apply an ultrasound jelly, a thin layer, spread it all over. Then with in-motion technology, while the laser is being performed, just make sure that the tip of the handpiece is constantly in touch, full contact with the skin, and you have to treat one grid at a time. Only after the device stops treating one grid is when you move on to the next. And if at all there's any excessive erythema, you come down, change the fluids, apply mild cortisone lotion and change the area. Now, what are the immediate skin changes that you can anticipate that you should not be scared of and that you tell the patient you may see? There could be mild redness, erythema, a little bit of papular urticaria is also known and seen, slight pigment changes, if at all, very, very transient, they do not last long. Mild swelling of the treated area also could be noted, but usually is not seen with the more sophisticated lasers that we have. A lot of patients describe the laser as like a rubber band snapping on your skin kind of a sensation, but if you're using a triocluster diode, usually the sensation's more like a hot stone therapy, with in between you just feel like one or two jhatkas here and there. So, what is the aftercare? What do you tell the patient? What is the take home message when they're gone home? Please moisturize the skin well. Avoid any intense exercise. The sweat can irritate the treated skin. So, it is like any other procedure. It's a treated skin that you're looking at. You make sure that there is no itching and scratching of the area that is being treated. Avoid swimming. Again, no intense workouts. Sunscreen has to be applied in the sun exposed areas. Avoid frequent shaving. If at all you're coming for your next session, shave like at least a week before, and you make sure that you have at least some little a little stubs for us to mark the area that we're going to be treating. No waxing at all. Why we say no waxing is because we want to retain the root. We do not want you to be plucking onto the root, and no bleaching, because if you bleach, you're taking away the pigment and you're decreasing the efficacy of the laser. Now, this is what the experience at our clinic looks like when you come to us for a hair reduction, and this, I'm sure